The following portion of Studio 512 was sponsored by CPI Health. Did you know September is Pain Awareness Month? Capital Pain Institute offers comprehensive pain management services, and these providers really understand the impact that chronic pain can have on people's lives. Dr. Iden Cowan is here to tell us more. And Dr. Cowan, I want to ask first and foremost, why Pain Awareness Month is so important and what folks should know about chronic pain, because there are some misnomers out there.
Absolutely, you're right. You know, as an interventional pain and spine physician, I have firsthand knowledge and seeing how chronic pain can negatively impact lives. It's not just the pain or discomfort, it's people, their function and their mobility that's limited, their mood, their sleep quality, their ability to work, and also to enjoy social engagements with their friends and family.
So we are hoping to give hope back to people's lives. Can you share an example, actually, if you wouldn't mind, of someone who has received treatment from you and had a big improvement?
Yeah, absolutely. I have so many, but there's one I was thinking about as I was driving here today. She's a mother, she was a nurse, she was coaching her son's soccer team, and she had an injury that any of us could have. She tripped off a curb, and even though that initial injury healed, she was actually in a wheelchair when I saw her. She actually wasn't even able to wear shoes because her foot was hurting so badly she was wearing flip-flops only. We opted to do what's called a dorsal root ganglion stimulator trial, and that's the beauty of this type of device. You can always test it before you actually have it implanted. So now she's walking, she's wearing heels, she's coaching, she's hiking, she's a consultant. For me, that's really what this is about.
That's actually the last question I just want to ask about, is how you involve patients in decisions about their care.
Oh, for sure. Kind of to get back to your initial question about acute pain versus chronic pain. So, you know, we've all stubbed our finger or toe, or maybe, you know, went to drain the pasta and touched the hot pan and our fingers burned. So those types of pain, that's going to improve. But if it doesn't get better after a couple of months, you know, then it becomes more chronic. So that's that 3-month point. Before that, what I would recommend is, if it's persistent, seek care with your primary care physician, talk to them about it, start some physical therapy. I would not be able to do what I can do for my patients without my team. They help schedule the patients for their procedures, they help answer the questions on the phone, so teamwork makes the dream work.
It does. They do say that. All right, Dr. Cowan, thank you for your time.
Yes, my pleasure. Thank you.
Capital Pain Institute has multiple locations in the Austin area. Find the one nearest you at capitalpain.com. The preceding portion of Studio 512 was sponsored by CPI Health.